Hi, Dr. Christensen here, and welcome to my office. Today what I'm going to show you is something that I think is really cool, and it's something you'll be able to do at home to help your friends and family relax the muscles in their back and their neck. This is something I picked up at a seminar I attended with a Dr. Alan Bonebreak from Texas. And what we find and what he describes and what the literature bears out is that there are certain reflexes on the body found in the skin that will influence the tightness or the looseness of the muscles. Often when a muscle is overly tight, we know that muscles move bones and bones pinch nerve. If a muscle is too tight, it can pull things out of balance and create a decrease in nerve flow, a decrease in circulation. And so when you find a couple of these reflexes and stimulate them, then these muscles can relax. And so this is a quick, safe, easy thing that you can do on your own. And so the first one is done with your patient or your subject lying down on their back. So go ahead and lie on your back, head up at the table here. And so what you do is you lift the subject's legs and you rotate them in. And if you can see clearly here that the right leg does not go in as far as the left. I could rotate the legs outward, and they're fairly balanced that way. A little more restriction on the left than the right. What I want to do is I want to loosen up this right leg, and so to do that, I simply hit a reflex point found on the inguinal ligament. The inguinal ligament is found from the hip bone here down to the pubic bone. And so when I find this ligament, what I do is I put my fingertips and I find the most protruding bone on the front of the hip, the anterior hip, and then I bring my heel down to the pubic bone. And so just be careful because it's a touchy area. And so the point is halfway between there. And so all I do is I simply tap on that point. You can see I'm tapping fairly firmly. Often the point is quite tender. 3 or 4 times is all. And so once I tap that point, I rotate the feet in again, and you see the difference. It balances out. I can rotate the feet outward. I'm finding a little more restriction on the outside here. Go to the other side here. Tap on that inguinal reflex point. Bring the legs in. Bring the legs out. And you'll find that the muscles that support the back, the gluteal muscles, will have relaxed and balanced. The next one I'm going to show you is on the back. Go ahead and sit up for me now, face away. And what I'm going to do is I'm going to check the range of motion of his neck. I'm going to turn the head to one direction. I'm going to turn the head to the other side. And I'm finding there's a little more restriction going to the left than the right. The movement is simply done by brushing the hand across the neck in the direction that you want to go. So I turn his head to the left, I brush across here, I'll bring it back to neutral, I'll turn the head, and I get an increased range of motion. Going the other direction, I can brush across the other. It's not a specific point that you're hitting, it's just a general brushing. Front of the hand, back of the hand. The nice thing about this is he can do this himself and just brush across the neck just like that, and it's going to increase his range of motion. The next maneuver is done by crossing your arms over your chest. So cross your arms over your chest. We rotate one direction here. We rotate one direction here. I notice that he goes to the left, or rotating to the right, excuse me, more than to the left. And so I'm going to rotate him to the side where the range of motion is diminished, and I'm simply going to make a big X across his back. What I'm doing, it looks like I'm doing nothing, but what I'm doing is I'm actually activating the stretched nerve receptors in the back. And so I go across here, I'll bring him back to neutral, I'll rotate him again, and we see an increase of the range of motion. I can do both sides here. And we increase the range of motion. I can work down the back. And so here, I can go farther down the back into the mid-back area, rotate again, and we see an increased range of motion. Come the other direction. Again, I'm just making a big X. And in essence, I'm waking up some of the nerves. Finally, we can go down to the lowest part of the back, the low back here. Again, just a big sloppy X. Rotate. And you can see here, his range of motion is increasing. Go to the other direction. It's non-specific, but it works. And they notice the improvement. Go ahead and lay on your back one more time. Coming back just to check these again. And we're balanced and equal here. And so go ahead and try these maneuvers. Again, they're safe, they're easy, they're amazing. You find someone with some significant restriction in the neck or the back or the hips, and you tap on these points, you make the big X, and you can see improvement right away. So I hope this is helpful for you. Try it on your friends, try it on your family. If this is a new YouTube video for you with us, be sure to subscribe, and we'll see you again next time.